Hi, my name is Elena Bergeron. Today is October 8th, 2019. I will be talking about the nervous system and the eye for my organ within the nervous system for Module 8 discussion, midterm discussion. So these are my note cards. Let's begin with the nervous system. The reason I chose the nervous system is because it's so important because it impacts our whole entire body, and there's so much to always be learning about the nervous system. It helps with the lower body, the upper body portions, the lower body portion, and it is extremely complicated and fascinating within our face. So the nervous system, the different type of medical specialties that are learned in relation to the nervous system are neurology, neuroscience, neurosurgery, and neuroanatomy. Neurology is clinical. They do not perform any type of surgical procedures in the study of neurology. Neuroscience is also clinical. They also don't do any surgical types of procedures in the study of neuroscience. And neurosurgery is actually surgery, is a surgery branch or study, surgery-based study of the nervous system. And then last but not least, we have neuroanatomy, which is also clinical. And they also do not do any type of surgery in the study of neuroanatomy. Neurosurgery can also be called neurological science. It's another common name for the surgical study of the nervous system. For the organ within the nervous system that I chose is the eye. The reason I chose the eye is because it's another system within a system that's very complicated and is a major organ that we use on a daily basis. We use it for vision, which is very important, since we have our senses that rely on one another. So, for example, when you're tasting something, you rely on not only seeing it, but also smelling it and tasting it, so you know what you're consuming and when you're eating. Vision's a very big part of when you're eating, so you can address and identify what you are eating. So for the location of the eye, it is on the anterior portion of the skull. So if you were to look at the skull from a lateral view, you would see that the eye is on the anterior portion right here. So not the posterior portion. It's also inferior to the eyelid, so it's back behind the eyelid. If you were to divide the body in the middle, the eyes are on both sides of the bodies are medial to the midline of the body. They are proximal to the nose, so the nose is an indicator of the middle of the face, and so the eyes are medial to the nose. And then we have the anatomical landmarks for the eye. The anatomical landmarks include the pupil, the retina, the optic nerve, lens, and cornea. The reason those 5 anatomical landmarks are so important to the eye is because people understand what portion of the eye you are looking at or discussing when you mention these landmarks. So if you're talking about the retina of the eye, you're talking about the posterior portion of the eye. If you're talking about the pupil or the lens or the cornea, you're talking about the interior portion of the eye. And you even know that you're talking about the interior cavity of the eye when you are talking about these, or you understand that you're talking about the anterior cavity when you're talking about the pupil, lens, and cornea. And then when you talk about the optic nerve and the retina, people know that you're talking about the posterior cavity of the eye. Also, these landmarks are used for when people are talking about diagrams for the not only dissections in labs, but also in diagrams of the eye itself. Great example is the cow eye dissection that we did, and there were actually instructions telling us to cut muscle and other unneeded portions of the eye that were close to the optic nerve or the optic stem. Yes, so again, my name is Elena Bergeron, and this is my review for the Module 8 midterm.